The aim of this course is that every staff member will confidently promote and support mothers with lactation management. A baby-friendly hospital implements the 10 steps to successful breastfeeding, accepts no free supplies or samples and no promotional material from companies that manufacture or distribute breast milk substitutes, and fosters optimal feeding and care for those infants that are not breastfed. Step 1. Have a written breastfeeding policy that is routinely communicated to all healthcare staff. Why is it important for a hospital to have a written policy that is visible? What should a breastfeeding policy cover? A breastfeeding policy should include the 10 steps to successful breastfeeding. And it should include an institutional ban on acceptance of free or low-cost supplies of breast milk substitutes, bottles, teats, gifts, samples or coupons, and use of materials distributed by formula companies. Step 2. Train all healthcare staff in skills necessary to implement this policy. For medical staff, a 20-hour lactation management training is included in the 2-week training of all new nurses before their deployment to their assigned area. Meanwhile, an 8-hour lactation management training is required to non-medical personnel. Training should include advantages of breastfeeding, risks of artificial feeding, mechanisms of lactation and sucking, how to help mothers initiate and sustain breastfeeding, how to assess a breastfeeding session, how to resolve breastfeeding difficulties, orientation and education on hospital breastfeeding policies and practices, importance of feeding on cue, positioning and attachment, and risks of artificial feeding and using bottles. By the time a baby is born, the new mother must be comfortable about breastfeeding, understands its benefits, and what she has to do. The health system must advocate for breastfeeding information and discussion opportunities to be made available for all women, individually and in groups as part of all antenatal care. Importance and benefits of breastfeeding. The WHO and UNICEF now recommend that every infant should be exclusively breastfed for the first 6 months of life, with continued breastfeeding for up to 2 years or longer. B. Bonding. Emotional bonding prevents physical and emotional abuse. Are readily available. No milk preparation is required, no boiling of water, no electricity, no use of plastics, no feeding bottles. Can breastfeed anywhere, anytime. And no bacterial contaminants, no toxins, no chemicals, no allergens in human milk. Breastfeeding is infant-led feeding. Baby keeps on feeding frequently at times because it is easily digestible. Breastfeeding also decreases incidence of feeding intolerance like constipation, diarrhea, vomiting, A. Antibodies. Colostrum is nutritious and contains high levels of secretory IgA that protects babies against infection. Colostrum is also called the original liquid gold. How many child deaths can we prevent this year? This is the Lancet Child Survival Series, published in 2003, which looked at preventive interventions to save children's lives. With 23 interventions, notice that the only two-digit figure in the graph is breastfeeding at 13%. Breastfeeding is the #1 intervention to prevent child death at 13%. Yet not enough emphasis is placed by everyone on breastfeeding as a life-saving intervention. Breastfeeding decreases risk for pneumonia, ear infection, asthma. Breastfeeding decreases incidence of necrotizing enterocolitis and diarrhea. Savings, save, SIDS, sexy. More savings for family and society, saves lives, prevents SIDS, easier to be sexy. Mostly in pediatric clinics and those admitted in the hospitals are children who are sick, on milk formula. Powdered milk does not contain antibodies, placing these children at risk to infection. Breastfeeding saves 2 lives, both the life of the child and the mother. Breastfeeding reduces incidence of breast CA, ovarian CA, postpartum hemorrhage and depression. Breastfeeding reduces incidence of sudden infant death syndrome or SIDS. And it is easier for mothers to return to their pre-pregnancy weight. Breastfeeding mothers lose 500 to 600 kilocalories per day. Teeth temperature and teeth. Temperature is right and teeth is nice, no dental caries. Perfect food. Breast milk is perfectly made by God. It contains all nutrients, growth factors, minerals and vitamins the infant needs for growth for the first 6 months. Breast milk is 88.1% water, the rest are nutrients. No other liquids or food, no powdered milk, no water, no vitamins, no pacifiers are necessary. Prevents ear infection. Environment friendly. Decrease incidence. Breastfeeding prevents all forms of malnutrition, that is stunted and obesity, as well as adult-associated diseases, namely diabetes, stroke, and hypertension. There is a link between the adult-associated diseases and feeding from the start. That is why the healthiest start in life is breastfeeding. Breastfeeding prevents all forms of malnutrition. Prevents diabetes, stroke, hypertension, leukemia, and reduce incidence of allergies and asthma. Higher intelligence scores, IQ. A meta-analysis done by Anderson showed that breastfeeding compared to formula feeding correlated with higher scores for cognitive development. And no contaminants. Breast milk is safe, clean, and has no contaminants. It is important to have good personal hygiene and proper hand washing. Always on the go. Always remember the benefits of breastfeeding. Help mothers initiate breastfeeding.